All right, everybody, so we are back. We're just doing some more sessions as we get everything set up for our clinic. I can't help myself but do acupuncture on people because when I see people in pain, we have to help them. So today we've been working on some knee pain. There was a fall a number of years ago, and so a lot of pain in the joint with pressure and walking. So this is our second session and felt really good after the first session. Did a very similar treatment. Did some local stuff, so eyes of the knee, ran some electrics between there, top and bottom, just to catch the joint spaces and really like open up the knee. Distally, using points on the middle finger works really well. You can do series below and above, which are nice, but I kind of cheated it out a little and went into the joint space to match the joint space where the pain really is in terms of our patient here. So did that, added a couple of things like lung 5 and spleen 9 just to help with tie-in and drain some dampness. Spleen 6, series across like spleen 6, I love just a coarse chi and blood, which is really useful. We've had a lot of pain in the base of the heel. There could be a bone spur, maybe a little bit of plantar fasciitis. And in the heel, so you gotta think we're like bladder meridian and kidney meridian. And so I've used distal points across heart and small intestine, and basically I've surrounded the pisiform and touched it. So at the start of our treatment, we had her stand up. There was a lot of pain in the calcaneus when she was stepping. Had her sit down, needled and touched the bone, so bone for bone. Those 3 points really surrounded the inside. I'm on the distal part of the pisiform to match the distal part of the calcaneus, and worked really well. Stood up, no pain, feeling good. A little tender in the hand. Those are strong points, but works really well. Went local onto the elbow. There's a little bit of tennis elbow going on, and so just matched that. And you know, the matching of like elbow to knee is kind of nice. It'll help with the knee, and the knee points will help with the elbow, so that works well. Added in lingu just to like move chi and blood overall. Real simple, gentle treatment. You know, a little bit of electrics going on, so just coursing some stuff locally, but really using the distal points to like guide everything and enhance that. So that's some of the stuff that we're seeing here. A lot of physical stuff. It's, you know, I've noticed some really interesting things about treating people in Nicaragua where there's a lot more physical labor happening, and so when you do points, I think that the meridians and the tissue is generally more like engaged and used to working. So when we add points, I'm seeing different types of results. I'm also noticing that the tissue to needle in is a little bit tighter. It's more fibrous because they're used to like real work, eh? Which is an interesting thing I've noticed like clinically here. And so adjusting treatments for different sort of environments of working has been good, but I'm noticing a couple of stronger results in certain areas because of the lifestyle here. Anyway, lots of stuff to learn, really enjoying practicing, and if you want to come down and play in paradise and practice with us, we're opening stuff up.